This is 41 Today on 41 NBC.
Good morning and welcome back. Today we have Dr. Omar Ahmad joining us from Atrium. Thank you for being here today.
Thank you for having me.
I'm glad to have you. We're going to talk about this upcoming flu season. What do we need to know about the flu?
So influenza, commonly known as the flu, is a respiratory virus. Starts about October, peaks about December time up to February, and can last up until May.
Wow, that is a long time. And so with it lasting possibly from October to May, how do we prepare for it? What do we do?
The best way to prepare is to get your flu vaccination. Good hygiene, wash your hands several times a day for about 20 seconds. If you have a cough or sneeze, you should make sure that you cover. If you're feeling sick, stay at home.
Mm-hmm. And so I want to talk about that. You mentioned getting your vaccine. Who should get their flu vaccine? What do we need to know about it? How can you prepare people for this? What do we need to know?
So we recommend the influenza vaccine for ages 6 months and older. The most at risk for influenza are children less than 5 years of age and 65 and older. Patients that have chronic comorbidities such as asthma, COPD, patients who are diabetic, coronary disease, patients who are immunosuppressed or more at risk.
Wow. And so is there anything, I think sometimes we have a fear of vaccines. What do you want to tell people who may be nervous or have never gotten their flu vaccine? How do you provide them peace of mind knowing, hey, this is okay to get?
Vaccines are safe. I think this is a discussion that they should have with their primary care physicians.
Talk to your doctor.
Talk to your doctor.
And so I want to talk about it. Let's say you're feeling a little under the weather. You know, it kind of gets that tricky time. Like you said, the peak is December. Holidays, we never know. Are we sick or we blame it on allergies? We always, we have those fun things. I want to know, though, what are the symptoms we should be looking out for that maybe say, hey, you might have the flu. You need to go to your doctor.
Common symptoms can be mild. They could be fatigue, body aches, low-grade fever. Severe symptoms could be persistent high fevers, productive cough, decreased appetite. If any of those symptoms develop, they should definitely see their provider or see us at the urgent care.
Okay, and so I have to ask, is it possible for the flu, you don't need medicine and it can just go away naturally, or do you need to see a doctor? How do we kind of figure out, is it okay to stick it out, or hey, you need to go seek that extra medical care?
Flu can be devastating. I do think that early in the symptoms, you should see your primary care physician.
Yeah, there's the fine line, right?
There's the fine line.
Okay, and so as we enter flu season, is there anything else that people need to know? How can they get connected? What should they be talking to their doctor about? Anything else we need to know?
They should talk to their doctor about getting their vaccines.
Just stay safe.
Stay safe.
Wash your hands, right?
Wash your hands.
Wash
yes.
your hands. This
yes.
is a tricky season, and again, that time frame is October to May.
To May, yeah.
Wow. All right, if you'd like to find out more about this, head on over to our website, 41nbc.com.